So the video that I chose is about a nurse who was assaulted by a patient whenever she was actually trying to leave the room. So this nurse had given her patient all the prescribed medications and turned to step out of her room because her nursing care for the time was completed. When she turned her back, the patient jumped over the bed rail and attacked the nurse from behind. The nurse described how it took 6 other members of the healthcare team to get the patient off of the nurse, and all of this resulted in the nurse actually tearing her rotator cuff. Initially, when I heard that the nurse had been injured and required surgery because of what had been done, I was shocked. I feel like a lot of times whenever workplace violence is discussed, especially in nursing, it's people getting shoved up against walls, people getting punched, kicked, things like that, which obviously all those things are absolutely horrible and none of them should happen ever. But this requiring surgery is something that I would have been so upset about. So the nurse described how for her personal peace, she decided to pursue the patient in court. I actually respect the nurse's decision to do this. I don't know if I would have done the same in that situation initially. Maybe if the medical bills were too high to where I wouldn't want to pay for them on my own, then I would definitely pursue the patient in court. But I respect the nurse's decision. I feel like a lot of times as nurses, it's kind of expected for us to almost be okay with things like this just because our profession is so, like, we're in people's faces. It's kind of an invasive profession in general, and nurses brush things like this under the rug all the time. So I definitely respect her decision to actually pursue her in court. She stated that while in court, they told her that it was essentially her fault for not medicating the patient faster and for not being attentive enough. She also stated how the hospital kind of was understaffed and there weren't enough security there, so all that could have been avoided if the hospital was adequately staffed. But regardless of all of this, the hospital remained unsupportive during this entire case. So this enraged me that the physical assault was being brushed under the rug as a nurse's fault, and even the hospital that she worked for wasn't backing her up. If I was this victim and a patient attacked me from the back, I think that my first instinct would have been to drop to the floor and try to roll the patient off of me. Obviously, we can't fight back and physically harm the patients, so I would definitely be trying to get the patient off in any way that I could without hurting them, obviously. It's hard for me to put all the blame on the patient or the nurse just because I don't know all the details of the situation. But regardless, I think that the nurse is definitely not at fault for anything here, especially since she ended up with a torn rotator cuff and is now going to need surgery for that. To prevent and manage workplace violence in nursing, I think that a couple things should be implemented. So one, I believe that a buddy system should be implemented for high-risk patients. So this means that if a patient has a violent history and might be categorized as high risk, the nurses should go into the room with another person so that they have backup, essentially, should the patient become violent and try to assault one of them. Secondly, I think that educational training about workplace violence and how to defend yourself without harming others should be implemented. So like I mentioned, we cannot physically harm patients. We obviously don't want to physically harm patients. That is the complete opposite of what nursing is. But some self-defense against workplace violence should be implemented so that nurses can defend themselves from aggressive patients without harming the patient themselves. So this might include things like getting out of chokeholds or even just to break away from a grasp so that the patient can get away, or the nurse could get away. And lastly, I think that nurses should be encouraged to speak up and make it known when violence occurs so that others will be aware of and learn to look for signs and symptoms of workplace violence. So no matter how minor the incident is, nurses should speak up about this. This way, others will feel confident and validated when wanting to report violence, and the stigma of causing a problem will slowly go away so that advocating for ourselves will finally be seen as normal.